My name is Felicia Jeffrey, and I'm a clinical director here at Bluebonnet Trails Community Services. Our role as providers is to provide accessible, effective, and efficient services. At Bluebonnet Trails, we believe people can and do recover from mental health issues. And to this end, we provide a wide array of services to our youth and families. These services include case management, where we link and coordinate and assess the progress of the person accessing our services. Skills training, where we address coping at home, in the community, and at school. Counseling services, where we address and challenge thinking as it relates to emotions and behaviors. Wraparound services, where we collaborate with community partners to ensure the success of the youth and their family. Parent training, where we empower the parents and caregivers to address the ongoing needs of the youth that we serve. Parent support groups, and medication training.
Case management services consist of providing support and guidance during ARD meetings or meetings with school administrators, during any court hearings or involvement with juvenile justice, or during any times that Bluebonnet Trails Community Services should be represented as related to the client. Case managers will link families to resources and will help identify additional services needed that are not already in place. As a case manager, I am the point person between the psychiatrist and the family, so I will resolve any medication issues by consulting the relevant individuals. Skills training consists of teaching youth and families methods that can include anger management, coping tools, behavior modification, or any skills that are determined to be beneficial to the youth and family. The different service packages we provide are routine services, which include medication management, case management, and skills training. If you're admitted into our intensive services, you can expect to receive medication management, case management, skills training, family partner services, wraparound services, and our family support group.
Coordination services are provided between the child and adolescent case manager and the mobile crisis outreach team when children and teens need a face-to-face evaluation to determine their treatment needs in a crisis situation. If the child or teen is hospitalized, at the time of discharge, I collaborate with the psychiatric hospital to ensure a smooth transition from hospital to home.
Case management services consist of providing support and guidance during ARD meetings or meetings with school administrators, during any court hearings or involvement with juvenile justice, or during any times that Bluebonnet Trails Community Services should be represented as related to the client. Case managers will link families to resources and help identify additional services needed that are not already in place. As a case manager, I am the point person between the psychiatrist and family, so I will resolve any medication issues by consulting with relevant individuals. Skills training consists of teaching youth and families methods that can include anger management, coping tools, behavior modification, or any skills that can be determined to be beneficial to the youth and family.
My name's Leo De La Garza, and I'm the Director of Special Programs here at Bluebonnet Trails. A few years ago, we were able to retain some funding from the Department of State Health Services to identify family members that were doing well in their recovery, to help other family members here that were enrolled at Bluebonnet Trails. In this position, this particular family member was called a family partner. And this family partner will engage family members and help them better identify what they can do to become a stronger family unit. They can provide linkage to other services. They can communicate sometimes better with another family member than with a case manager. So this person, the family partner, has been able to really develop that resource for family members here at Bluebonnet Trails, and we continue to expand that resource today. Family partners are engaged usually with our most intensive cases that are identified here. but they also serve other family members that continue to have a need. That position, a family partner, might also recruit families into the family support program that we have here that occurs twice a month on Wednesdays from 6:30 to about 8:30 or so.
The CRCG is comprised of public and private agencies, and together we develop service plans for individuals and their families whose needs can be met only through interagency coordination and cooperation. Some of the agencies involved in the local CRCGs are Texas Juvenile Probation Commission, Texas Youth Commission, Texas Department of Aging and Disability Services, the Texas Department of Family and Protective Services, the Texas Department of State Health Services, the Texas Department of Assistive and Rehabilitative Services, and local school districts.
I'm Mark Janes, Medical Director and a Child and Adolescent Psychiatrist for Bluebonnet Trails Community Services. Bluebonnet Trails Community Services is a community mental health center that serves 8 counties in the central Texas area. Psychiatric services primarily are focused on doing diagnostic evaluations and medication management. We also work with the other team members to help develop a treatment plan that's individualized for the child and family.
Dr. Janes and I regularly meet with each client and their parent or caregiver at our center to assess the client's needs, functioning, and access to community resources. I attend the doctor's appointment to assist in evaluating my client's progress, to identify any barriers, and to review their medication.
We provide many of these services on location at our different county clinics. We also provide telemedicine services. Telemedicine has allowed us to be able to deliver expertise into some of our smaller counties where it's difficult to have a psychiatrist or nurse practitioner drive to, because the drive would reduce the amount of time available for clinical services. So we have found that telemedicine helps improve the efficiency and has been very well received by our patients. Our child and adolescent patients in particular seem to enjoy it. Of course, they tend to enjoy things that are technical. And we have found that most individuals have found it to be very effective in terms of receiving services.
Bluebonnet Trails was recently awarded a 4-year grant by the Substance Abuse and Mental Health Services Administration. The aim of this grant is to work with children and families who have been exposed to trauma or have military backgrounds. The grant will serve children ages 3 to 17 and will allow us to provide trauma-specific services, therapy services for these kids. One of the therapies that we will provide will be trauma-focused cognitive behavioral therapy, which kids will work with the therapist to process the trauma and look at their cognitions and how they think about the trauma, how they think about the world around them, and help them feel a little bit safer and maybe less guilty about the trauma. The other therapy that we will be providing is the parent-child interactive therapy, which works with parents and children who have been exposed to traumatic incidences, work on the relationships together, work through the trauma through working through relationships together. This is usually focused on the younger kids, ages 3 to 5. The grant as a whole aims to work with Bluebonnet Trails staff to provide trauma-friendly services. So the grant will provide training and help Bluebonnet Trails staff better understand how to work with individuals with trauma and provide services that will lead to better outcomes.
Well, I think at Bluebonnet Trails, we have an executive leadership that's real supportive of providing individual families and those that most in need in our communities. And without that leadership, our services would not be as powerful as they are today. So we're lucky that we have a leadership and a board of trustees that really wants care in the communities and in all of our communities. We have 8 counties that we operate under, and we have a board of trustees from each of those counties that oversees everything that we do at Bluebonnet Trails. So we're lucky in that we have a leadership that really promotes mental health care and services locally.